Okay, thank you. Hello, I'm Cynthia Schendel, and I serve as co-chair of the Social Work Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I asked the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. Andrea Perdomo Morales.
Present.
Donna Painter Quayle, sorry. Sarah Behrens. Mary Gill.
Present.
Mike Gillette.
Here.
Lee Ann Gingery. Angie Heller Workman.
Present.
Jane Holzrichter.
Present.
Catherine Reck. Did I see her?
I do see her. I think she said present, but her
Okay.
audio is a little distorted.
Eric Schonecker
Present.
and Kristen Stice. Robin Unruh.
Present.
Okay. I note the following BSRB staff members are also present: David Fye and Leslie Allen. Next, David Fye will read a message concerning this meeting being held remotely. David?
Thank you, Cynthia. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the advisory committee to allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or COMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting, as no individuals had requested to provide public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of COMA are not suspended. Therefore, we will be conducting this meeting pursuant to the COMA. On August 30th, 2023, we sent notice of the advisory committee to all individuals who had requested notice of advisory committee meeting. Notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice for the meeting is on the agency's website, and other meeting material has been posted on the agency's website as well. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the BSRB office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And the conference call line is active. I did check it before the meeting. No one was on the conference call line, but if someone beeps over, I will let you know.
Okay, thank you, David. The first thing on our agenda today is to approve the agenda. So has everyone had a chance to look at the agenda that David sent out?
Here's a furniture store.
I'm sorry?
Hello?
Jane, I think we're picking up some background noise, so
Hello?
I'll go ahead and mute your connection there.
Thank you, David. Do I hear a motion to approve the agenda as provided? I'm sorry. Did anybody speak up?
All motion to approve the agenda.
Thank you, Andrea. Do I have a second?
Second it.
Thank you, Mary. Agenda is approved as written. Now we need to approve the minutes from the August meeting, which also were provided by email. If everyone had a chance to look at that, and anyone ready to make a motion to approve, or are there any corrections?
I'll make a motion to approve.
Okay, thank you. Do I have a second?
I second it. This is Angie.
Thank you, Angie. Okay, all in favor? Aye.
Aye.
Any opposed? Thank you. Minutes are approved. So now we are moving on to our executive director's report from David.
Thank you. I'll share some updates on BSRB operations and also some information about recent board meetings and then some additional meetings of note here. So first, beginning with some updates on operations. We are very much in a time of transition here in the BSRB office. As we have talked about at past meetings, there was a very sizable bill that passed during this legislative session, Senate Bill 131. And that bill allows us to establish several different license types that are brand new to the BSRB. We also are able to provide more flexibility to individuals to help make sure they stay licensed. There are some creative approaches the board took to helping people come back and practice again after their license has expired and they've been away for several years. So there are lots of really positive things that happened because of the passage of that bill. However, it is a lot of additional tasks for the agency to set all those things up, and now that those things are all available, to make sure that we are incorporating those new tasks in and also trying to process license applications and renewals as quickly as possible. And so with the passage of that bill, we obtained authority to hire 2 new staff members, and we opened that up to outside applicants and applicants here within the agency as well. And happy to report that those 2 positions have been filled. There were some current staff members that wanted to challenge themselves and take on some additional responsibilities. And so we interviewed a number of applicants, and they were the 2 best people for those positions. And then with that change, it opened up the other positions. And so we advertised those and then interviewed candidates for those. And so as of a few weeks ago, we are now fully staffed, and we are in the process of helping people learn their new roles and responsibilities and figuring out the new juggle of responsibilities for other staff members here in the office. With the passage of that bill, it was our best estimate that we would need 2 more licensing specialists to try to make sure that we could do everything appropriately. But we did give the caveat that we would continue to monitor this to see if that was really all that we would need, or if we would need some additional assistance as well. One of the items that I put into the agency's budget when I submitted that back in mid-September was some funding for temporary staff members to be able to bring in when licensing is especially busy or when we need help for special tasks. Right now, one of the logistical issues is we have a very limited amount of physical space here at the office. And so there is not adequate space right now based on how we had been having staff members set up in the past. And so we are thinking creatively and working towards having 2 staff members share an office and work remotely a few days per week. We're also in the process of trying to convert some of our paper records. Some of those we're trying to move to archive, and we've adjusted our document retention schedule to do that. But we do need to keep some records here on site. And so we're in the process of trying to move some of those records to the storage we have upstairs here in the building, and then free open some of that space so that we can utilize other areas of the office. And so just a lot of spinning plates and a lot of dominoes that are falling, and we're working with other agencies to make sure this all works. And appreciate all the assistance from the Office of Information Technology Services. As part of this too, we've obtained new laptops for some of the new staff members to make sure that they have better technology to use. There's just a lot of logistical things, and we're trying to figure those out right now. So earlier this week, we had a number of individuals who were pulling wires through walls and through ceilings to make sure we were all set up. So just a lot of things that are we're juggling at the moment, but hope to have those all resolved here soon. You may be working with different individuals on some of the tasks here in the office based on some of the things that are changing. And so we will be making some updates to the BSRB website, and it should reflect the new staff responsibilities. Concerning some other operational changes, I mentioned the passage of that bill allows us to offer several different new license types, and those all are available on the website. The last time we talked, I think we had rolled out most of those, but there were still a few left to go. As of about the middle of August, those have all been made available. We also, in order to issue those as early as possible, we had pursued temporary regulation on the fees so that the fees could be set and we could issue those. We also followed those up with permanent regulations, and we have been in the process of having that time period open for public comment. And then we had a meeting here in the BSRB office on October 3rd, to allow individuals from the public, if they wanted to come and provide any public comment on the fees. We didn't receive any additional public comment, but that is one of the requirements when you're putting in permanent regulation. And so now that we have had the open period, we've had the official meeting, we've also gone before the Joint Committee on Administrative Rules and Regulations. The next step will be for the board to take a formal roll call vote for those regulations. And so we are going to have the board go ahead and take that action on Monday at the board's special out-of-town planning meeting. And so we'll kind of transition to that note. Once a year, the board seeks to hold an all-day planning meeting, and if possible, all board members try to come together in person. That meeting historically has been at different locations around the state, and so last year it was in Kansas City. This year it'll be in Wichita at the Seasons venue in Watson Park, and information on that has been put out, and it's on the BSRB website. But that will be an open meeting, so anyone from the public who wants to attend it is welcome to do so. It'll be on Monday, October 23rd from 9 a.m. until 4 p.m. The board will still have its normal board meeting in November, but that's a meeting that is set up for the board to talk more about items like the legislative agenda, also for them to have more discussion on items that would require additional discussion. And then we're also going to have the board members. And Leslie, I think I'm picking up some background noise, so I'll just go ahead and mute your connection there. And so at that meeting, we're also going to have the board members do a little bit of visioning exercises and talk a little bit more about the unique roles that they play as members of the board, because we have 8 professional members, 4 public members. And so we're going to have the board members kind of work with each other a little bit and get to know each other a little bit more in that process. I'm looking forward to that meeting on Monday. Concerning some of the other items for the BSRB, I'll go ahead and move now to some of the items from the most recent board meeting. The board did meet in September, and just a couple of items of note from that September board meeting I want to make you all aware of. Previously, the governor had reappointed 3 board members and had appointed 2 new board members, but we were still waiting on the board member for addiction counseling to be appointed. At that September meeting, it was announced that Jill Flexing is the new board member for addiction counseling. So she takes the board member spot previously held by Deb Stidham. So we've been working with Jill to get her up to speed on the items involved with the board, and really looking forward to working with her as a board member. Some of the other items that were discussed by the board at that recent board meeting included the item that your advisory committee has discussed before, which has to do with the current rule and regulation on changes to an approved clinical training plan, that those changes have to be submitted within 45 days. And the board has sort of a new discussion on a possible solution for that item. We'll talk about that a little bit more at the board meeting here, or the meeting here today. Secondly, there was also discussion about practitioners from other professions serving as supervisors for certain professions. And the language currently exists, which allows other practitioners from different professions to provide supervision to professional counselors and marriage and family therapists. But the language in the regulation requires that there be an extenuating circumstance for needing someone from those other professions to be able to provide supervision. And so the question really that we had brought before the board is that test the appropriate test? Because the term extenuating circumstances is defined in regulation. It does call for an extreme condition that basically would make someone ineligible or unable to meet the requirements in regulation, or make it impractical and unadvisable for them to meet those requirements. And so as it applies to this type of scenario, it may not be the best test to have in the regulation, but it's kind of brought up a broader conversation about whether those professions want to allow individuals from other professions to provide supervision or not. There are some professions that do not allow others from other professions to provide supervision, whereas the addiction counseling profession allows different professionals from other professions to provide supervision. So it's kind of a bigger topic. And so the board talked about it at that meeting, and they'll be talking about that again on Monday at the out-of-town planning meeting. Further, at the board meeting, board members were informed about a recent change to federal law that has to do with the Service Members Civil Relief Act and portability of professional licenses for service members and their spouses. This is a federal law change that we are working through with our legal counsel, but essentially what the federal law was intending to do was to help out military members and military spouses when they are licensed in one state and they are moving to another state. It is an alternative to traditional licensure as best as we understand it, that would allow those specific individuals to be able to practice in a state after they provide certain information under a sort of license recognition type scenario. So they would not need to obtain a license in Kansas under this. However, there's been a lot of questions concerning the implementation of it. If we're not issuing them a license, how can we list them in the license verification portal or otherwise to make sure we're providing public protection in terms of who's providing services in Kansas? If they commit an act that would violate our unprofessional conduct, what authority do we have over them in terms of issuing a fine or suspending them? Or so some of these issues we're still kind of working through, but a lot of states are wrestling with this at the moment too. I've also reached out to some of the other agencies here in Kansas to see how they're handling this, and so still collecting input, but we can definitely make an announcement on the website that if someone is seeking to use this to practice, they can provide information to us and we will follow up with them on that matter. Additionally, the board is working on an additional item with the passage of Senate Bill 131, and that is that the bill talked about, it authorized the board to create language and regulation for an expedited application process. There was no model that was provided when this was introduced from other states or other agencies where they said, we want you to look to what the state is currently using successfully to implement this. It was just very general language for the board to create a policy on that. And so we are working with the board to try to find language on that. We've had a few discussions at board meetings, and I think soon the board will be able to review some draft language on that to possibly move that forward to the regulatory process. And then there's one other item that I wanted to highlight for you that the board talked about just briefly at that meeting that they plan to discuss a little bit further, and that is the current requirement and regulation for individuals accruing hours towards a clinical license. And that has to do with the 1 hour requirement of supervision for every 15 hours of direct client contact. And that is one of the items that individuals are discussing to see if that is still a good standard to keep in place, or if that is something that they should be looked at further. So now I'll talk about a few of the most recent meetings that I wanted to make you aware of. Earlier this year, this advisory committee had talked about a desire for the BSRB to have roundtables or other meetings with individuals from education, educators across the state, and then also potentially to have a similar meeting for employers across the state. And so in the past, in doing some research, I am aware that the BSRB has had physical roundtable discussions with certain groups of educators many years ago. But to my knowledge, these were in-person meetings with a handful of individuals around a physical table. And with the growth of programs, we wanted to try something different to make that happen. And so we organized an event, an hour-long informational forum for educators and a similar hour-long informational forum for employers. The informational forum for educators was on Tuesday, October 17th, and the one for employers was on Wednesday, October 18th. And we tried to use as a base the previous mailing list for the educators, but as that list was several years old, we were unable to reach a lot of different members from different schools, and so we tried to reach out to others, and we held the event. It received a lot of positive comments and feedback from individuals who attended. We tried to let them know that this was not intended to be a one-time event. We hope to set this up as a recurring type thing. And the way this one was organized was we wanted to make sure that in having good discussions, everybody is on the same page, at least in terms of what has transpired over the last few years. And so I put together sort of an informational presentation that started with the 2021 legislative session and highlighted a handful of bills that were relevant to the BSRB. And so we talked about some bills that changed the way that supervision hours could be accrued and some of the flexibilities in terms of being able to do supervision by televideo instead of just in person. We talked about some of the changes to the length of licensure for some of those professions. Also talked about some of the modernization of things like the out-of-state temporary permits. We covered different bills from 2022, and we talked about Kansas joining the SIPAC Compact, the Multi-State Compact for Licensed Psychologists. We talked about adding back some language to allow the BSRB to evaluate applicants for clinical licensure for social work, even if they didn't have a clinical practicum. Some flexibilities that were added to enable people with a master's degree or higher level license to be able to take the test to become a licensed addiction counselor if they wanted to do so. And then we talked about some bills from this past session, including the one where Kansas became a member of the Multi-State Compact for Professional Counselors, the large bill, Senate Bill 131 that we talked about. We also discussed a bill that was a broader bill that affected a lot more agencies back in the 2021 session that dealt with changes to reciprocity. And so we kind of covered the major items from most of those bills just to make sure that we were all speaking from a place where we were aware of all the recent changes in law. We talked about perhaps holding a similar meeting like that in the future and talking about proposed changes to regulations and some of the effects of those. Some of those are still working their way through the process, but I think the next time we might be able to hold one of those and talk about those items. But yeah, those were both well received. I got a lot of good emails back from individuals who attended those who thanked us for putting those on, and we plan to continue to build those lists of contacts. If we were aware that we likely missed some groups of individuals from certain schools or some groups of employers, but we wanted to start with reaching out to people and then use that list as a base and continue to add people on that. And so,
David?
Yeah.
Excuse me, would you be able to send that PowerPoint that you gave at those meetings to the committee?
Sure.
It was a really good overview of the last several years and the changes that have happened. There's been quite a few, in a relatively short period of time. So I think it would be very helpful for everybody to have that kind of in front of them.
Yeah, and the slides were very similar for the educator forum and the employer forum. Would you like me to send out both PDFs or just send out one for the employers?
I thought it was this. I didn't realize there was a difference because I just attended the educator one.
Yeah, just the first slide referenced one was specific for the educators and then had the date, and then the other one had the date for the employers, but otherwise the slides were the same. So.
Okay, just one of them is sufficient. You pick.
Okay, that sounds good. And yeah, I agree though, there has been quite a few changes over the last 3 years. And I think part of this is also helping people make sure that they are aware of some of these changes. One of the things I thought is if we have a roundtable and we really haven't had these foundational meetings first, there could be people that are upset about something that we've already changed in law. It's just we haven't, or maybe we can add more visibility to those things or put out more information about that. So I wanted to make sure we were all on the same page and we're aware of all these changes in law, and then we can talk about maybe other things that could be helpful in the future for the different groups of individuals. Another item, and we talked about the board's out-of-town planning meeting on October 23rd. Also, I did want to let you all know the social work compact group. They are holding a meeting at the end of October, on October 31st. There's an informational briefing on the compact. I'm not sure if there will be any additional or new information that will be shared at that meeting, but it is being put on, I believe, by the Council for State Governments, and so I'll be attending that to see if there's any new updates. If there are, I'll be happy to share them with you all at the December meeting, but that'll be on Tuesday, October 31st. And then Andrea Perdomo Morales and I will be attending the annual meeting for the Association of Social Work Boards, ASWB, and that'll be in Memphis just at the beginning of November. So that should be November 3rd and 4th. So we'll both be attending that meeting and collecting information and having discussions with others from other states and bringing back that information to you all as well. So there's lots of other things going on, but I think for the sake of time, I'll go ahead and end my report and see if there's any questions.
Hearing none. Let's move ahead with our old business. Thank you, David. We have our clinical training plan discussion that we've been having, and this has to do with the 45 days that are required. You have to notify the board if you have a change in your original clinical training plan within 45 days. And if you don't, then the hours that you accrue after that cannot be counted. And we've run up against this several times and had to deny clinical hours because people did not notify the board of the changes. So we've been talking about ways to mitigate that and make that less of a requirement, because the way it's written right now, we have felt like we have to go that route. So the discussion has been go ahead, Jane. You had a
Cynthia, I
question?
was just going to ask you, what were some of the examples of denials? What would be some of the reasoning that they were late?
You mean what the reasons they gave for being
Mhm.
late? Well, a lot of them they never notified at all, and they don't really have an excuse, because both the person who's applying for licensure and their supervisor sign off at the beginning that they've read all the rules for the clinical training process and agree to abide by them. And so they theoretically know that they're supposed to notify the board within 45 days of any changes in the clinical training plan. So, we've had people, we had one recently that was talking about, COVID and that kind of discombobulating everybody, and that was their reason for failing to inform. We had one where they said that they had written it up and thought they'd sent it in, but they didn't. So, but most of the ones that I've heard about, Andrea, correct me if you have another thought about it, are just that people forgot about it or didn't remember that they were supposed to notify the board. Leslie, do you have anything to add to that as far as reasons we've had to deny on that?
No, they say that sometimes they'll say that they didn't realize they needed to make that change in writing to the board. But most of the time they forgot.
Yeah, they didn't remember that as one of the rules. So what we've been trying to look at tweaking that language some, and to talk about notifying to change it to them having to notify the board of substantive changes to their clinical training plan. So, and then we've talked about what those substantive changes might be. And, we've talked about certainly a change in the supervisor would be one, a change in setting, particularly if it's a different type of client that you're going to be working with. If you worked for a mental health agency and you went to a different office, but you were still seeing the same kind of clients with the same supervisor, maybe that wouldn't be considered substantive change. If we changed or proposed changing the language that way, it would leave the board then to figure out what constitutes substantive and what doesn't. So that would create, some additional possible difficulties or disagreements about what's considered substantive. But we also talked about then the penalty of not counting the hours, that the language might be changed to there shall, or they may have those hours not counted rather than shall, which again gives us some wiggle room. If we don't have any number of days, if we don't have any requirement of notification within a certain time period, then there's not much of a point in having a requirement of notification at all. If it would just be at the point of applying for their license that they would say, oh yeah, I had a change, a year ago or 6 months ago or whatever. At that point, there wouldn't be much that the board could do to enforce that, except for disallowing those hours. And that's what we're trying to avoid, is having to have people get up to the point of licensure and find out that they are, 300 hours short or whatever. So,
Thank you.
Andrea, do you have anything to add to what we've talked about, or in explaining what we've been talking about in terms of this regulation?
No, I think you did a great job.
So I guess I'd like to hear from the committee about what you think about those changes, changing it to substantive changes rather than any change in the original training plan, and saying the word may instead of shall regarding the penalty of not counting the hours.
Yeah, and Cynthia, I'm going to go ahead and pull that regulation up so we can take a look at
Okay,
the exact language of it too.
thank you.
This,
Cynthia? Oh, go
Mhm.
ahead, Dave.
this is just for reference. This is KAR 102-2-8. And the language that's kind of being referenced for this 45-day rule is item 7, which is, if you print it out, it's on page 3 of those materials. But I've gone ahead and highlighted that language that references what you had talked about, Cynthia, the rule that all changes to the clinical supervision training plan have to be submitted by the supervisee to the board for its approval. And the changes shall be submitted no more than 45 days after the date on which the changes took effect. And if the supervisee fails to submit the changes to the board within that 45-day period, no supervised hours of practice shall be accrued or credited for any practice beginning on the date the changes took effect through the date on which the changes to the plan are approved by the board. So that is the existing language in that regulation.
Cynthia,
you, Deb.
I was also going to tell you that in a couple other meetings, there was someone suggested leaving that all changes should be submitted within the 45 days, and then striking if they fail that they'll lose that they lose the hours, and that would allow, if they come in late or with the application even, it would allow staff to look, and if the changes meet the requirements, then the hours could be counted, and if they didn't, then it would have to go to the board.
So they would still be required to report changes within 45 days, but if they fail to do so, it wouldn't matter as long as the changes still met the requirements for the clinical training plan. Is
Right.
that
Yes.
okay?
I was just letting you know what some other committees
Yeah.
talked about too, so.
So that would be another way to give us some wiggle room to not have to deny hours that people have accrued after a change in their training plan.
Mhm.
So,
And Cynthia, I think one of the reasons why some people were interested in the, I guess, option number 2, because option number 1 is what everybody had been discussing in terms of adding more flexibility and talking about substantial changes, not just all changes, and highlighting specific instances that would need to be referred. I think one of the issues when we were really working through that and trying to figure out that language was from the licensing board's perspective, if individuals called us and said, well, this is not one of those items that specifically highlighted, but what is a substantial change? Would the board reject this or would they accept it? And we came down to some of our staff felt like some of the direction they would be providing would be somewhat vague. We never wanted to be in a position to where we would say, well, we're not sure if the board would accept it, but you can take a chance and see what happens. We would want to make sure that we can give them kind of clear direction and as much as possible, provide them clear and consistent guidance. And so as an alternative to that scenario, we thought this would be something that still keeps the 45-day language. It still makes it clear that we do need to have changes provided to us, but it has to do more with the consequence of, if they didn't meet that 45-day time frame, would we be able to review those hours later and approve them if they were still in alignment with the training plan, or what would be approved under the regulations, or would it be the strict language we have right now where they would have to be denied? So
I'm
Well,
a little,
go ahead.
I was just gonna say, I'm a little torn on which way I think's the best, but the substantiated
Substantive changes.
substantive changes. I think we would have to be a little more clear in what that is. Otherwise, it opens for bias, and the challenges then can be very great based on that alone. I'm sorry, I'm in the middle of a major move of our Child Advocacy Center, and so it's crazy.
I
So-
think I understand a little bit how that works.
Yeah, with what's happening
So,
at the office.
so based on that, that's my concern. I think it needs to be laid out on
So
what the examples would be.
right now, it's any change. So if anybody calls the office and asks, do I need to report this change? The answer is always yes, the way it stands now. But if we changed it to substantive changes, yeah, then we have to define what counts as substantive and run into the possibility of someone, being upset or thinking that, well, you let this one through, why didn't you let this one through? So yeah, that would open up that can of worms. What does anybody else think?
I like option 2.
Of leaving it as 45 days requirement
Mm-hmm.
for any change, but
Mhm.
eliminating the penalty of not counting the hours and
Right.
letting the licensing specialists figure out whether it would be approved or whether the change affected the eligibility of the hours, and only if they didn't, or there was a question as to whether they did, would it then come to the full board? Is that what you were talking about, Leslie?
Yes.
Okay.
So as someone who had to change clinical supervisors during my time, I can't get away from the fact that I signed a document the BSRB approved that said I would keep the board posted. And we're talking about social workers are responsible to encourage our clients to advocate for themselves. Could we do something such as, if you make that change within the 45 days, you're good, or if you alert the board within the 45 days, you're good. However, if you don't meet the 45 days, then you need to go through a process of advocating for yourself to complete the hours. Such as when I renewed my licensure this last time, I had to explain, because I had some health problems that impacted some things on the questions. And I completed it, well, it was like 2 paragraphs, and boom, bang, bing, that's all it took.
So I want to make sure I understand this right, Robin. So, so you're basically saying, if you make a change, it should be submitted within 45 days. And if you fail to make if you fail to submit the change to the board within the 45 days, the individual will need to basically explain to the board why
Yes.
hours accrued after the change would still be in alignment with what the regulations would allow.
Yes, put that back in the supervisee's hand. I guess I think the supervisee should have to do the most work to get for those hours to count, as opposed to the licensing specialist or anything. Just a thought.
No, I think that's an interesting topic. I don't think anybody has previously mentioned that, but that would probably save us time from a license perspective in terms of trying to take the new hours after the change and make that determination. We still need to verify that, but putting some of the responsibility back on them if they didn't meet the 45 days, I think that's very interesting. Yeah.
And so the consequence or the penalty then would be that you have to justify, or you have to write up your reason why the hours that you completed after you failed to notify the board of a change still fit the training plan requirements and should count towards your licensure. Is that what you're proposing?
Yes, because I realize things happen. But I do think there are times when those hours should count, but the social worker needs to be encouraged to justify the why.
Well, and Leslie might be able to weigh in on this too, but if you have a specific training plan that's approved that designates who the supervisors are and let's change supervisors, you know, technically that would not be matching your original approved training plan. But I would think if we asked those individuals if they make a change and fail to submit the change within 45 days, they will need to explain or provide an explanation of why the hours accrued after that point were still in alignment with what the statutes and regulations would approve or you know, allow for clinical hours, as opposed to whether it's still in compliance with the original training plan that was approved, because it probably wouldn't still be in alignment with what was originally approved, because a new supervisor would be something that would be a little outside of that. Is that, Leslie, what are your thoughts on that?
Well, I thought she was saying, explain why they didn't do the change, which would be similar to what we have now, and then it would have to all go before the board. Unless I mean, if they say they forgot, then what do we do?
Well, what about if it was, you know, and we definitely that's a possibility. I guess the way that I heard it, and this may not have been the way that other people heard it, but it sounded like, you know, the main purpose in having an approved training plan is to make sure that the hours that someone accrues are in alignment with what the statutes and regulations say are allowable hours under those statutes and regulations. And so if they have one that's been approved and then they make a change that, you know, is a modification away from what they were originally approved for, I would think it would be helpful if they could explain to the board why the hours after the change are still in alignment with what the statutes and regulations would allow.
Well, but honestly, I think the form does that. The form asks the questions about the change and they either meet or they don't. So it doesn't, I mean, I guess
Well, I'm thinking of, you know, if this occurring at the point of applying for licensure, when somebody's failed to notify, which is what we've come across, you know, repeatedly. So it's not like I forgot to do it in the 45 days and now it's 6 months later, I'm still finishing my training, but I'm going to submit the form late. Then you would get that information like you were just saying. But more often, at least what I've seen, is they get clear to the point of applying for licensure and, oops, I never notified of this change. So are you saying then we would have them fill out that change form then at the point of when they're applying for licensure, and that would automatically include information about why the change still fits into the required
right. I mean, that's what
practice?
we normally use to determine whether or not it meets requirements. So if the form shows it meets requirements, then
But has that been what we've done? Is if they get to the point of applying for licensure and they haven't notified of a change, we have them fill out the change form then?
yes,
Oh, okay.
that's what
Got it.
we've been bringing to the board lately. It hasn't always been like that.
Okay.
But so that the board can see what the actual change was, we've been asking them to complete the form.
So, and
I would
I
think
know
option 2 is what I'm leaning towards, but I don't know what others think, or if there's
Option 2 of eliminating the penalty of automatically losing those hours.
yeah,
Although that still would be
it could be an
possible
option. Yeah.
if the change isn't acceptable.
Right.
Okay. So then would we need to leave in some language and just change it to may? Because if we eliminate any language about the possibility of losing hours, if you don't report would we still be able to disallow anything, any hours?
Oh, I
there's
think so,
nothing-
because it says it has to be submitted to the board for its approval. So if they submit it late, but it's not approved, then they can't count those hours.
So we'd still have that ability to
Yeah,
disallow the hours, even if we strike that whole section.
right.
Okay. Any other thoughts? Robin, you were about to say something, I think. You're muted, Robin.
I was just going to add that when I have done clinical supervision as the supervisor, every 25 hours on what we have to do, I've gone back and reviewed the supervision plan. And I know maybe that's what the piece I was missing. I was not communicating on my thoughts, because I think the supervisor is very responsible as well. So just sharing that.
Yeah, I agree. I mean, the supervisor signs off that they have read and will abide by all of the rules of supervision as well. But I believe the regulation puts it on the supervisee to be the one to notify the board. But the supervisee should be reminding the supervisor should be reminding the supervisee about that. You're right. And I think that's a good practice to review every 25 hours what the training plan is. So I've heard several say that they were in favor of option 2. Anybody else have any other comments? And then maybe we can take a vote as to which we might want to propose. So option 1 would be to add the word substantive changes and may instead of shall lose hours. So option 2 would be to simply leave it as is and eliminate the second part that says they would lose any hours after the unreported change. And this would still allow us to do that, to disallow hours if the change does not meet the standard. But it would also give us flexibility of not having to automatically do that. So all in favor of option 1, changing the language to adding substantive and may. Okay, are we back in? That's good. Okay, all in favor of option 2 of being able to eliminate the losing your hours if you don't report automatically.
I do think, and Leslie, you may have said this, but I mean, I think we do have to say somewhere that there's a chance that their hours may not be counted, just in being transparent.
That's why I was saying if we could add the word may instead of shall to that second part, that gives us the flexibility to allow or disallow based on whether or not those hours actually meet the standard.
You could add may. I like adding may because I think that does the flexibility. And then you could just say dependent on a review from the board or whoever, and just add that component to it. And I think then it would resolve that.
Well, I think, Leslie, you were saying that you would be able to, or the licensing specialist would be able to review whatever the change was and hopefully determine whether it met the standards, and only those ones that weren't clear would actually come to the full board.
Right.
For discussion. Okay. So how does everybody?
Parent saying something in that revision, I think that would be important so that they understand.
It's a possibility.
And you can't see my hand. I can't get my video back up.
So oh yeah, no, I can't see it. Sorry.
Sorry. So
what were you going to say, Angie?
I like the choice of changing the word to may, and then also the second part where we're going to look at that individually. So, because I think when we look at it, we don't want to not give people an opportunity to come in as a profession. And if we're going to allow people who haven't really had that much experience start to have that opportunity, we at least need to have the people who have been actively trying to become licensed to review their work that they have completed and making sure that they are on the right route of the hours that they've committed. So anyways, that was my thought.
I guess it depends to me, from the staff's perspective, in what you mean by may. If you mean the training plan does or does not meet the requirements, and if it doesn't, then we say you can't count these hours.
Correct.
Or if you mean you're going to look at every change for the board to determine whether or not they think it counts. That's where.
Yes.
So how, I mean, I don't think we want to set it up that the board has to consider every change and decide as a full board whether they meet. So how should it be worded that would accomplish what we're talking about, which is having it?
Well, mainly just the board's intention. If you're saying that they may lose the hours, if you only mean that they may lose the hours because the job they changed to doesn't count or they don't have a proper supervisor, then that would be one thing. But if we're looking at the reason why they didn't send it,
oh, I see.
That's
okay.
more,
Yeah. So it would need to be if the hours do not meet the standard, that then they may be disallowed.
Okay.
We'd need to state it clearly that the reason that your hours may not count is because they didn't satisfy the standard of would that take care of that issue of them not having to come before the board?
Yes.
For every change. It does kind of a little bit, that takes the teeth out of the idea of having to report in 45 days. It makes it seem like it's more optional or not really necessary, as long as you think your hours are gonna, be the same, still meet the standard. Right. And of course, since the bill that just passed or passed in the last legislature is going to change what meets the standard, that's going to be another factor in this. It's going to be harder for us to say anything doesn't meet the standard because of that change in language, but that's another discussion. Okay, so I think everyone voted for the idea of eliminating an automatic loss of hours, and then is everyone comfortable with adding if the post change unreported change hours do not meet the standard for clinical licensure or training, then those hours may be disallowed?
Yes.
Right.
Yes.
Everybody okay with that?
Yes.
Okay, good. Then we will add that to what we'll be talking about with the full board. Continuing, we also need to look at the continuing education standards. Can you put that one up for us, David?
Yes.
And this had to do with the documentation for your continuing education. What counts as documentation?
Yes, and
right.
when I sent these out, I may have sent them out in reverse order. But the first one that has to do with continuing education is on your screen now. Is KAR 102-2-4A, and that is continuing education for licensees. And then you also have KAR 102-2-5, which is documentation for continuing education.
Okay. All right. And so what were we wanting to change on the first one, on what counts as continuing education? I think I remember there was self-study. We talked about eliminating that because nobody ever does it, right, Leslie? You're muted, Leslie.
Sorry, it would be the self-directed learning project.
Right. We talked about eliminating that as allowable continuing education? Does anyone have a thought about that or think we ought to leave it in? Apparently, that's been rarely ever done, if ever. Is there anything that we think should be added as allowable continuing education? There's a few of them that there's only a certain number of hours that you can have in that modality, but it's a long list of things that can count as CE.
I know we had a discussion on the DEI earlier in the year. But is that something that we would allow within these hours because it would fit in the scope of practice?
Yeah, we tried to make it a requirement that it would be 3 hours of our CEs, and the legislature struck that. But that doesn't mean that we can't count it if we choose to take that training.
Yeah, and when it comes to individual categories like that, like the ethics and the diagnosis and treatment hours, those are referenced in the statute. So in terms of adding something like that, we probably couldn't add it just to the regulation. It would probably need to be something that would be, if it's set hours in a specific category, it probably need to be something that would go into the statute for consistency. But if it's within one of these other categories that we currently accept, that's not an issue, I don't think.
So what category would we put that under?
Well,
now,
the listings now are like about the modality, the type of continuing education. So if you took an academic class in DEI, if you a program presented by an approved program provider, all those categories. It's not the topics that are listed in the regulations, it's the type of continuing education.
right.
And so any of these types of CE that would be about diversity and equity, would be countable as continuing education for license renewal.
Okay.
So is everyone okay with the idea of eliminating the self-directed learning project? Anybody think we ought to leave it in? I'm not seeing
No, I think we need to eliminate it.
Okay.
I was going to say, since we have the regulation on the screen, it's kind of hard to see hands right now, but if you do have other thoughts or an objection, go ahead and vocalize them, and that might be helpful.
Mm-hmm. Yeah. Okay. Hearing no objections. The other change in continuing education. Can you put up the KAR 10225, David?
Mm-hmm. Yeah, this is 102-2-5.
Mm-hmm. And I'm not remembering what we wanted to change in this one.
So some of these regulations for other professions included some outdated terminology. For example, it made references to things like videotapes.
Oh, right.
Audio tapes. I'm looking through here, and I'm not seeing those terms in your regulation.
There's a reference to the self-directed learning project, letter I, that if we're going to eliminate that as a CE possible option, then we probably want to take that out.
It's in J, Dave.
Okay.
That it talks about audio tapes.
Thank you.
Oh, right. Oh, videotapes, audio tapes.
Yeah, and so basically what we were asking from some of the other advisory committees is just for the ability to go in and make some updating to some of those terms. So instead of taking them out, it would really just say video recordings and audio recordings, which would still allow videotapes, but it would also allow other modalities too.
Mm-hmm.
Yeah, I agree. That's the most current use of language.
Mm-hmm. And most people probably have a hard time finding a machine to listen to an audio tape on or watch a videotape on. Anyone have a disagreement with modernizing the language in letter J? Okay, hearing none, we'll add that to our list of proposed changes.
Okay, let's go
And-
back. Let's go back to the previous one. I'm guessing that probably, yeah, there's probably at least one that has reference, like in the previous.
Oh, there too. Yeah, videotape. I see.
Yeah, 102-2-4A. So if you're okay with it, instead of just trying to find them all right now,
Yes.
just as a standard thing, if we
Change.
references like that to update them.
Yeah. Yes, please.
And then there was one other topic, and maybe Cynthia, you were about to cover this, but did you have anything further for these regulations?
Not for the continuing education. We had now the unprofessional conduct regs.
Okay.
And we had talked about the issue of crisis care and what the standard. We've had several lengthy discussions about that. And in June, I think it was in the June meeting, we agreed that there should be language that it would be unprofessional conduct to fail to have a plan for crisis care appropriate to the needs of the client. That was the kind of the general language that we settled on, because we couldn't come up with a specific standard for that. What was a blanket standard that would be considered appropriate crisis care for every client.
Yeah.
In the past, it was that you needed to be available in a crisis and have a answering service that could get a hold of you or carry a pager or whatever. But now we're saying that we need to come up with a crisis care standard that's appropriate to each client.
And Cynthia, before we move to that topic, there is one more thing I wanted to make sure we had just a small discussion on.
Okay.
For the continuing education items before we moved off of these regulations. So to help out the different advisory committees for the board, I went ahead, we mentioned that when it comes to specific categories of hours, like the ethics hours and diagnosis and treatment, that those are in the statute. So we don't have a lot of flexibility in terms of changing that. There are 7 different professions that are overseen by the BSRB, and the total number of continuing education hours does differ by profession. And so you do have some more flexibility if you wanted to examine or revisit the total number of continuing education hours for your profession. So right now, there is an item B here. You have to get 40 continuing education hours every 2 years. And I understand that some of the history on that is that it used to be higher and then it was lowered. As it currently exists right now for social work, it's at 40 hours. For the other professions under the BSRB, right now, licensed psychologists and master's level psychologists have to get 50. Your profession and marriage and family therapy have to get 40. I believe the addiction counseling and behavior analysts have to get 30, and I think professional counseling as well is 30. And so what I did just to help out the different professions is I tried to look to see what other states required for their total number of hours to see if we were in alignment or how we fit, basically. For your profession here, I went and looked at all the different states, and what I found was that when you look at the total number of hours for each of the states, and some of the states have 1 year licensure, some have 2, some have 3, so I prorated it to get a good number. But the most frequent number that's required by the states is 30 hours. And so there are 18 states now that require specifically 30. There are 15 that require 40. The average number of hours required between states is about 33. For states that border Kansas, Missouri requires 30, Nebraska requires 32, Colorado requires 40, and Oklahoma is kind of an outlier. They require 16 from what I could find. So I did want to let you know that to see if you wanted to discuss that as a topic, the total number of hours. I can let you know one of the other professions, the master's level psychologist, they also had me look at continuing education hours for psychology programs around the country. And I think at least in terms of the total number for psychologists, we're towards the high end with 50. And so they are making a recommendation to the board to move to 40 for their profession, which is more consistent with the majority of states and what they require. So for your profession, it appears that the most frequent number required is 30, although most states require between 30 and 40 hours, with that average being about 33. So just wanted to highlight that for you and see if you wanted to discuss that as a part of this conversation.
Yeah, thanks, David. So yeah, we discussed it in our planning meeting for this meeting, and we kind of went back and forth between the idea of dropping it in the interest of making licensure and relicensure easier, and our whole concern about making it possible for people to get licensed and stay licensed. But then we went back and forth between would that 10 hours, if we drop to 30, would that make any difference in terms of whatever the value of our CE, whatever we think that is? Does it enhance professional competence to do 40 hours of CEs? Does it enhance it more to do 40 versus 30?
I personally would leave it alone. Am I on?
Yes, you are.
Okay. I personally would leave it on from an agency that pays for my training to doing private practice that I would pay for my own training. I don't think that makes that much of a difference. And if you look at just 20 hours per year over a 2-year period, there's very few trainings that we cannot attend or go to that doesn't allow us to get those hours. I think there's other things I would rather put my focus on than reducing hours. I think 40 is sufficient. So, yeah, that's my opinion, my professional opinion.
Thank you, Jade. What does anybody else think? Eric.
Yeah, I was just thinking about, so getting loads and loads of CEUs isn't really all that hard, but I don't know that there's a huge betterment between the 30 to 40 range. And if I'm getting 50, 60, 100 CEUs every 2 years anyway, what's it matter if it's 30 or 40? If you could make it more achievable for somebody who doesn't have the resources to purchase those CEUs or take off work for CEUs, things like that, I think that could be beneficial for people staying licensed. So I would sort of lean towards the idea of dropping it to 30 hours.
Your sense is that most people, and I think you were saying this too, Jane, that you feel like that's whatever, the 30 or 40, either one is pretty achievable for most practitioners.
Well, I'm like Eric. I mean, it's well in the 100, hours.
That you have to take.
Yes. By the time you get through orientation type trainings, your ethics, all of that. And even the things that we as a social work organization require, it's pretty quickly. And
well, orientation, just as an aside, trainings that are specifically about you doing your job, about your workplace, et cetera. My understanding is those are not.
No, but we have all those that piggyback on top of that, that are like your ethics and your cultural dependency, all of cultural competency, all of that. Hey, dads. Yeah. So I don't think that's the issue. What I don't want us as a social work organization is, I don't want us to, and this is not an appropriate word, but dumb down our profession. Just because others are doing it. We were the forefront we were the grandfathered program that started a lot of this, and I think we need to maintain that integrity.
I agree with that, Jane, but I do want to point out, like, those of us that have bachelor's degree, we don't actually get those opportunities for some of those trainings and that level by our companies or organizations that we have to practice because we're on the front lines per se in regards to every day working 40 hours. So I still think we should hold the standard, but I think sometimes the 40 hours might be just a tad too high, just a little bit.
Is it hard for you, Angie?
Yes, because I'm working so hard, 8 to 5, and it's hard. I do stuff in evenings and weekends, but you still have family, and so, but I did accomplish it, but I felt kind of bad this year because I was hoping to, accomplish more, when you set the year out of trying to attend things to further your education and your understanding, but it catches up with you. And I honestly did make it a priority in my schedule, but I still found it easy to maintain the 30, but it got closer to the 40. I was like, where's those 4 more hours? Kind of feeling. So, but I did accomplish it before the deadline. But
the one thing that comes to my mind in just thinking this through is there's a lot of people that are not attending some of the state conferences as much as they used to. And what is that going to look like, if we reduce our hours? Are the social work conferences, the governor's conference is going on right now. I'm not there, as you can see, but they have had some issues with those hours or the volume of participants. So all of the conferences are facing that some today.
So I've had some feedback of some people saying they did go and they got COVID still, even though COVID, I'm trying to say, so we're still kind of fighting that a little bit, but I know for sure the last few years, we still had that in the forefront that kind of caused some difficulties as well, especially in some of the cases I had to do a lot of remote. And a lot of those were offered only during the work hours, not in the evenings, like the NASW conference for leadership and stuff like that. So I'd had to take off personal time in order to attend those because some work don't let you off for that because I don't consider that part of your job, but it is your profession. but they don't consider that, just to let you know. So,
well, if they require that you be licensed, then theoretically they should allow you time to maintain your license and get your CEs. What about the rest of you? Katie, how easy is it for you to get your CEs?
I can echo a little bit what Angie said. When I worked at the state, it was a lot easier. Now that I work in long-term care, it gets a little bit harder to get them free, basically. So I've ended up paying for some of them now that I work in long-term care, whereas I didn't have to when I worked for the state. So it kind of sounds like people who have a lower level of licensure are ending up being the ones that are paying for continuing education to get up to that 40 mark.
Okay.
I actually pay for all mine and I have the highest level of licensure. And like I said, it can get daunting no matter what level you're at to spend the money. And I don't know that it's our obligation as a board to help attendance at seminars. So I don't know if that necessarily needs to be a criteria. They are going lower, but I don't know that that's really a reason to continue to require 40. I think the other piece of it is with CEUs being so prevalent, does going from 30 to 40, those 10 hours make you a better social worker than the 30 hours before did?
Yeah. I mean,
I would wonder because I do think and agree with parts of everything that everybody is saying. It's such a hard topic. I wonder if this is something that we can put out possibly to get feedback and see what the larger majority of social workers are leaning towards, and then take that information and then make some decisions from there.
So what we talked about putting out a survey, Andrea.
Mhm.
I like that idea. I also like the idea of if you have a bachelor's, if you hold your bachelor's in social work, that the hours may be reduced than the master's. And that could help in a way.
Yeah, we there could be I don't know if there ever has been a different standard.
Because a lot of times when you have your bachelor's, they don't look for your license because they just look for your LMSW in a lot of jobs. But if you have your bachelor's and you want to still keep your license, that's really up to you in some of those jobs.
So since they're not requiring the license, they're not facilitating.
And they're not compensating or anything like that. Yeah, that's correct. Yeah.
It's never been different that I'm aware of since '99.
Okay. So the same number of CEs has been required at all levels of licensure, bachelor's, master's, and clinical.
Now, and in terms of other states, I did kind of look for that because in trying to figure out what every state requires, there were some that had some unusual items in their hours. And so at least a few states, like let's say Oregon, I believe they license 3 levels of licensure as permanent licenses. And I believe they require 40 for the highest level, and then 30 for the next level, and then 20 for the lowest level. So it's definitely not something the majority of states do, but there are a handful out there that do have a different number. Now, the only downside of something like that is it could be a little bit of confusion. If you have one standard number for all in that profession, it's pretty easy to set that number and then everybody holds to it. If you have different numbers, potentially you could run into an issue where someone says, well, I thought we all had to get this number. And so just pros and
Yeah, certainly if we made any change, well, whatever change we make, even if we do it across the board, there'll be a learning curve with people, figuring out that there's been a change. And if we have graduated levels, then yeah, there'll be some confusion for a while.
So like for bachelor's, like 30 hours up to 40, which is preferred or something like that. I don't know. So you still got your 40 for the master's, but you still prefer 30s, whatever. And whatever I just said. Sorry. But
well, I think there might be some other questions that we would want to include in a survey. So does the committee feel like we should make this one of the questions and hold off making a recommendation until we get some feedback from the broader group practicing social work in Kansas?
Yes.
Does that sound like a plan? Anybody disagree? Okay, we will put that on the list for a survey and hopefully get that figured out soon, what other questions we might want to include on that. Okay, new business, multi-state compact. You told us in your report that there's going to be another briefing on it. What we know about it at this point is that they presented the finalized version, but it was too late last legislative session for it to be introduced in Kansas. It has to be a statute. It has to be a law that will pass to allow Kansas to participate. But we expect that that is going to occur in the new legislative session because there does seem to be a lot of concern, or has been, at least there was in the last session, about workforce shortage and the idea of making it possible for social workers from other states to be able to practice with clients in Kansas would expand access to mental health professionals theoretically. So anything to add to that update, or anything that we need to, I think we've discussed it multiple times. Do we need to have a committee vote, David, to recommend
Well,
that the multi-state compact be adopted now, or do we wait till it's actually introduced in the legislature?
so you have had representatives from the Council for State Government attend a meeting last fall and also last meeting and provide an opportunity to go over that and answer questions. If you feel comfortable doing so, one thing that was done last year was when the professional counseling compact was being floated around in different states to see what their thoughts would be. A representative from the Kansas Counseling Association went to the advisory committee and said, would you all be in favor of supporting this if legislation was introduced? And so they were in favor of doing that. So they made a recommendation to the board that if legislation is introduced, that the board be in favor of the legislation on the compact. And so that's what happened last year. And basically the board was able to take time after receiving that to research it independently. And so basically what you could do as an advisory committee is that if you do believe the compact would be beneficial and you would like to recommend to the board be supportive of the compact, you could make a recommendation today. And then that could get forwarded to the board, and then the board would receive that at the November board meeting, and then they would give them a chance to research it. And then at the January board meeting, the board could potentially take a position on the compact if it's going to be available in legislation. So that time frame does line up nicely. Now,
Okay.
You all as members have plenty of thoughts on different things. One item that will have to be resolved one way or another is balancing out the revenue for operational purposes for the BSRB. One thing that I've asked questions about and we've talked about before, the model that is going to be in this compact for social work is one that would essentially, you could obtain a single state license in the state that you reside, or you could get a multi-state license, which would allow you to practice in your home state and other compact states. What that would mean is that largely a number of individuals living outside the state of Kansas that have a Kansas license would no longer need to get a Kansas license to be able to practice in Kansas if the compact does pass in all those states. So that means the revenue we're receiving from individuals outside the state, that would be expected to go away. Now, to balance that, we would need to figure out how much Kansas should charge for a multi-state license that would enable our own licensees to be able to practice into those compact states. So that's something to be figured out. But with sort of that caveat, assuming we can work out all the logistics of that, I think you could discuss whether to be in favor of the compact, knowing that we'll need to work out some of those details.
And I did see in looking back in the notes that you had reported that we had a little over 1,000 licensees who resided out of state and had gotten a license to practice in Kansas. And those would go away if they were able to get a multi-state license in their own state.
Most likely. The compact does not force someone to give up their license, from what I understand, but I think there would be no financial incentive for them to keep getting licenses in all the different states. It'd probably be much cheaper for individuals to get a multi-state license in their home state and then practice into those states. So nothing would say their license would go away, but probably by the next time they were up for renewal, we would expect there to be a decrease in those renewals.
So that would be a decrease in funds. So, and just to remind us, this is a multi-step process. So once the legislature would actually introduce the bill, once it would get passed into law, and we would be signed up to be a part of the multi-state compact, the whole multi-state compact won't be a thing until enough states have passed that law and joined it. And what's that number? David, do you remember what the number was? Okay, Eric, thank you. Eric says 7 states.
Yeah.
And I think there were only 2 last year, if I remember correctly, that passed it so far, right? Missouri being, just one, and it was Missouri.
Mhm.
So, but hopefully there will be, many other states like Kansas that will introduce it in the next legislature. So, but it would likely be, I'm guessing, a year before things would actually be up and running, because they have to create their governing council for the multi-state impact as well. And that has to get, set up and get their regulations set, et cetera.
Yeah.
So,
That's
any
one additional-
discussion?
One additional cost that might be a part of this too. Some compacts basically charge states sort of a membership cost just to be a part of the compact. For the Board of Nursing, they get charged, I think, $4,000 every year to be a part of the nursing compact. So if there's additional costs like that, we'd have to figure out how to absorb that as well. But just one more thing to figure out.
Well, it would seem that that would be a reasonable thing to build into the multi-state compact licensure fee, is if we have to pay a fee to be a part of it. I mean, that makes sense. But so you all heard the presentation in August. I went back and listened to it since I wasn't able to attend that meeting, and I had heard the first one. Any thoughts, yay or nay? Did you come away from that feeling like you understood what it was, and are you in favor or yet not in recommending to the board that we join the multi-state impact if that becomes possible? Anybody have
I'm in favor of it.
okay?
I'm in favor of the multi-state compact too.
Great.
Agreed.
Agreed.
Okay, anybody not in favor of it or have objections or concerns about Kansas becoming a part of the multi-state social work compact? So can we have a vote to recommend to the full board that we join the multi-state impact compact, or support the adoption of the multi-state impact in the legislature? All in favor?
Aye.
Aye.
Any opposed? Okay, that's great. I guess we'll be able to recommend that to the board in November, and then they can be ready for the legislature in January. Okay, we just mentioned earlier about the survey, and one question that we want to ask about the CEs. Are there other questions that you all would suggest that we survey Kansas licensed social workers about?
I would like to have something on the survey that references testing, clinical, doing their 2 years of clinical training under supervision versus ASWB testing. And I would like to see how people feel about that, so that it can be discussed further then, or
Okay.
died based on people's opinion.
Are you? Let me make sure I understand you. You're asking about an alternative to taking the test?
Yes. The 2 years of supervision is the alternative of
Well,
completing that and getting that approved through the board or the office. But yes, that
You're
is
talking about eliminating the test then, because we already have to have 2 years of supervision. So
correct.
you're suggesting just
Correct.
you want to ask the question of, should we eliminate the
I would like
test?
to poll. Yes, I would like to see what people think, because there is a lot of talk on it right now.
Well,
I think
and
if
of
you're
course,
gonna-
go ahead.
I was gonna say, I think if you're gonna propose that question, I think it should be proposed in a way that, is there a level of licensure where the exam should be required? Like, if you want your clinical specialist, you have to pass the exam, whereas a bachelor level, maybe you can just substitute supervision.
Or master's level without the clinical, maybe.
Well,
Yeah, I
and
think there would have to be some discussion of that.
yeah, and I was thinking of it more, not at the foundational level, bachelor's and master's, because you're coming out of school from, those. But at the clinical level, you're doing the 2 years already of your clinical supervision. And a test doesn't necessarily speak to your work. Your supervision should be doing that. So that's where I was at in that mindset from just people talking. And so anyway,
You'd like a question about that. And of course, it's in statute, so there'd have to be a statutory change to eliminate the test. And I will say that most of the recommendations based on the data that ASWB released about the differentials in pass rates have not included clinical. There's been recommendations to eliminate testing at the master's level, but not for clinical. But we could ask at all about all 3 levels if we want to have that question on there.
Yeah, and I don't know how you want to pose it. That's up to you guys. It's just a thought. If we're going to put a survey out there, I think, it would be an opportunity to have feedback.
Okay. The other thing that's linked to, though, is the multi-state, because it does state that we would have that you have to have taken the exam.
Yeah.
You have to your state licensure laws. You have to have taken the exam to be eligible for the multi-state. So we need, if we were going to choose to propose to eliminate the test, we would have to make sure that there would be a way for practitioners who wanted to get the multi-state to be able to take the test independently. And right now, they have to apply for licensure and be approved to take the exam.
Mm-hmm. Right.
Now. But if we eliminated the requirement of the exam, then I'm not sure how they would be able to take it. We'd have to figure out a backdoor way for that.
They would have to probably take it in a different state that they're going to hold that multi-state compact under. So, but and it's just a thought. It maybe other people are disagreeing, and that's fine. I mean, let's do majority rule on something like this, but I think it gives us something to come back with ASWB if they don't fulfill some of their things that they've gone around, sharing that they want to see change. If they don't make that change, we have something that says, this is what our social workers are saying out here. Mm-hmm. And so it's not just us as a group, but even if we go to legislation, it has some backbone to it.
Mm-hmm. Okay. Anyone else have a thought about that, or how the question should be phrased if we include that on the survey? Or any other questions that you think we should ask?
So I'll throw one out there, because I do think since you've made a recommendation to support legislation on the compact if it's introduced, one thing that would be helpful for us is to know how many individuals would be interested in getting multi-state license, because that would help us try to balance out the amount that we would charge for a multi-state license. Mm-hmm. We know that there's, like you said, about 1,000 individuals who are living outside of Kansas. We would expect, at least within a few years of implementation, that those individuals would no longer renew their licenses here. But if we knew how many people here in Kansas might want that multi-state license, we could figure out some cost formulas there.
Mm-hmm.
Well, and maybe to add to that, what would people be willing to pay for the multi-state licensure credential? Like, so the BSRB would at least know, people would for sure pay this, people might pay this, people are really going to reject this kind of thing.
We could maybe have 3 levels and see are you willing to pay this or this or this to gather that data?
Or just how much would you pay to be able to practice in multi-states? You currently pay whatever $250 for a clinical license. Would you be willing to pay $350 for a multi-state license, or $450 whatever, or
Yeah.
you could even do a range. Would you be willing to pay 250 to 400, 400 to 600, 600 to 1,000?
Yeah, the only thing I'm thinking about that is there probably would be a lot of variation between levels of licensure. You know, there might be clinical individuals who have licenses in lots of states, where the bachelor's level filling out the survey may have very different thoughts. And so
Right.
doesn't mean it's a bad thing to ask, though.
I don't know if the Survey Monkey is sophisticated enough, but, and sorry, my printer's decided to clean itself. But if it said at the very beginning, are you licensed under bachelor, master's, clinical? And then it moves to those questions that are designed for that licensee. I don't know if the Survey Monkey can be done like that, but it would segregate those where it would be easier to then, develop the data from it.
And I don't have a great deal of familiarity with it, but I'll look into that a little bit more to see if perhaps we could sort those. In the past, when we've done questions about supervision, we've basically said if you were someone who's provided supervision, and then we would have them respond to it. But that is a, self-selecting kind of
Mhm.
versus somebody who would receive a different set of questions based on how they responded earlier.
Or you could just make the whole survey in sections. One, bachelor's, BSW, MSW, LSCSW. And then people could choose themselves which section to go to, if that's easier to do on SurveyMonkey. Any other thoughts about questions we might want to survey the social worker population about?
I know this is a very loaded question, but I feel like it does need to be referenced. In the past, we have asked questions about the diversity, equity, and inclusion topic, and whether social workers did support continuing education requirements in that area. In the past, the survey risk findings, at least by some individuals in the legislature, have rejected the responses that we got in our survey. But I believe the last survey that we had was in December of 2021, maybe. And at that time, I think over 60% of the social workers that we surveyed were in favor of having 3 hours of continuing education required in the area of diversity, equity, and inclusion. So since the results of this survey may be used for other purposes too, and things have changed in the last couple of years since that survey was put out, I just thought I would ask, do you think it would be appropriate to ask another question on the diversity, equity, and inclusion topic to have some updated information on that?
Yes. While you're doing it.
Yeah,
Right out there.
exactly. Yeah, the trouble we've run up against is that because it was proposed as a replacement for 3 of our hours, diagnosis and treatment hours, and it got struck because the legislature doesn't really care if social workers as a profession want to have DEI education. They have their own opinions about it, and so they didn't want to make it a requirement, but they slashed the diagnosis and treatment requirement by the 3 hours. So when we propose stuff like that, we're always at risk of something like that happening. That what we tried to get, because based on the consensus of the majority of social workers in the state, kind of backfired in the sense that we didn't get that, but we got a reduction then in the diagnosis and treatment hours. So whatever that's worth down the road, but that information could be used in other ways besides whether we propose it as a legislative change. So it'd be good to include it.
Would you like maybe an updated question on supervision as well? I know the last survey that was put out focused heavily on supervision, and we did obtain a lot of comments by individuals in terms of if they had experienced issues when receiving supervision or how much they had been trained when they had supervision in the past. So I could add a question on supervision just to see if there's been differences, maybe something that now we allow supervision by televideo, maybe whether there's been any issues concerning the televideo aspect or something involving supervision. Would you be in favor of a question like that?
What does anybody think? I mean, I guess it would be good to have some data since that change has been made of allowing video supervision for all
I think
of it.
the more things that we can offer on that survey to get feedback, the better we are.
Well, the data's or the information, the data's good for us. We just don't want to get it to a point where it seems too long and people won't take the time to answer it. But I don't think the number of questions we've come up with so far is going to create that problem. So
Survey fatigue does become an issue at a certain point, and we'll have a few short questions at the beginning and just to ask some demographic information that helped us last time to ensure that there was representation between the levels of licensure and the demographic areas of the state too.
okay. So what does anybody think about the supervision question? No thoughts on it?
I'm in favor of it.
I think it would be good to know if the people are finding video supervision to be, as helpful. And if it's enabled, I guess I'd like to know if it's really enabled people to get supervision and move towards clinical licensure who weren't able to otherwise. That was a lot of the reason we wanted to make it accessible that way, is for people in remoter areas that might have a harder time accessing in-person supervision. Well, I would say if after this meeting you have other thoughts or ideas about what we might include in a survey, please email me and/or David and/or Andrea, and we can see if we can add those questions.
Yeah, and just a note about that. Definitely, you can always send something to me, Andrea, and Cynthia. Just be careful of including too many more members of the committee than that. Your number of quorum is 7, so you don't want to have 7 advisory committee members that were kind of discussing things back and forth outside of a meeting. So if it's just a handful, that's totally fine. So yeah, if you ever want to send something to me, Cynthia and Andrea, feel free.
And David, when is the timeline of sending the survey out? Did we
didn't talk about that yet.
No, we didn't really talk about that. Once questions are finalized, it will take a little bit of time to kind of build that, and then I want to give people enough time to do that. I know last time we put it out there, it was put out for a few days, but it was over a weekend as well. And so how about if we give people, what do you think, a week or 10 days or so from this meeting, if they have any other thoughts on questions?
Yeah, I guess I was as far as when the survey would go out, if it would go out maybe, late November, early December. And although maybe getting into the holidays, people will be less likely to click on it and take it. But I was just thinking of if we have the answers and the data before the new legislative session, then if anything that comes out of this survey makes us want to propose a change in legislation, we'd have that information before January. So what would that mean in terms of how long it takes to create it, send it out, collect the data from the answers, David?
Yeah, I think late November would be good to go ahead and put that out. So how about if we say, if you have any additional thoughts on questions, go ahead and send them to the 3 of us, Cynthia, Andrea, and myself by October 30th. Does that sound
October 30?
Mhm.
Okay. Yeah, today. Yeah, that gives us 10 days. Okay. We want to talk about our meetings for 2024, and we've kind of jumped around when we've had the meetings this year. And so we were talking about trying to set a definite, like the second Tuesday or the third Tuesday or whatever we decided on. And then also we would have our planning meeting at a set time prior to that. We were talking about Tuesdays, I think, what, either 10 a.m. or 2 p.m. I think we had suggested the second Tuesday. Is that right, Andrea?
Yes,
David?
sorry.
Uh-huh. How does that work? Is Tuesday not good for anybody?
Well, I think we were talking about, yeah, either the first Tuesday of the month when we have meetings or the second Tuesday of the month, and then either a start time of 10 a.m. to noon or 1 p.m. to 3 p.m.
1 to 3. Okay.
I'd have to do the morning on Tuesdays.
Okay. Tuesdays is better. I see
In the
heads
morning.
nodding.
Tuesday morning works best.
Okay.
Easy.
How about you,
I can't do
Mike?
Tuesday morning.
Tuesday morning. And does it
That's
matter
good.
if it's first or second Tuesday? Does anybody have a conflict on one of those days?
Just not the afternoon on both. So,
Okay. How about second Tuesday, 10 a.m. to 12? Everybody okay with that? Raise your hand. Say aye.
I
Okay, great. Thanks. And then we can figure out a planning meeting time
Sure.
based on that
Um,
second Tuesday.
So
All right, where are we?
one small conflict. The next Marriage and Family Therapy Advisory Committee is going to be on the second Tuesday of the month in December, but I think after that, they're not going to conflict with that date going forward. So for the month of December, would it be fine to go ahead and put that on the first Tuesday of the month, and then looking into the next year, it'll be on the second Tuesday of the month at 10 a.m.
Is that okay with everybody? Yeah, in December, especially earlier is better, I think,
Okay.
for any meetings.
That means the next meeting would be on Tuesday, December 5th at 10 a.m.
12:05, 10 a.m. Okay. All right, that's great. Okay, so we have just a couple minutes left, and we were going to talk about some possible issues to address in the coming year.
Well, and Cynthia,
Oh,
sorry,
I'm sorry.
you started to talk earlier about the proposed changes to the unprofessional conduct regulations.
Oh, right. I'm sorry. We
And I
didn't.
know time is short, so that can be a conversation that gets continued to the December meeting if we don't have enough time to resolve those topics today. But
Well, the main one was the one that we've already talked about, and it wasn't included in what you sent out as our proposed changes in unprofessional conduct for social work. And so I just wanted us to hear the language and agree on that we decided on in June. And I don't know if do you have that written up, or do we
no,
need
I think I'm going to have to bring that to the December meeting.
Okay. All right. That's
Sorry,
fine.
it's been a few too many spinning plates at the moment, but I'll be happy to bring that for the next meeting.
Okay. I think that was the only one of the unprofessional conduct regs that we hadn't kind of finalized what we wanted.
Okay.
And so if everybody's okay with tabling that till December to just approve that final language, then we'll get that finished up for this year. And I think that was the goal, wasn't it? That everybody was all the professions were going to review their unprofessional conduct regs and have them, make recommendations by the end of the year. So
yes,
we'll get in under the wire.
No, that way the board can start looking at changes for all the professions start of next year. So that would be perfect.
Okay. All right. So then you see on your agenda a listing of workforce issues, and David already talked about the meetings with the educators and employers. We have on that list continued review and discussion on the ASWB exam release data. I don't think we have time to address that in this meeting. I do have the full report, which I'm still plowing through. I don't know if any of the rest of you have had a chance to read through it all, but there's a lot of information there. And what's interesting is that it's not consistent across all schools. So there are some schools, where they don't have the disparity in pass rates that a lot of the other places do. And so that's certainly something we want to think about and look at, is what's the difference, in the different, why are there not racial disparities in this area and with these schools, and there are with other ones. Also, it's worth noting that KU did not have as great a disparity as a lot of the other schools did. So, but that we don't have time to get into that whole discussion, but I would like for us to dig into that in the coming year.
And Cynthia, I did reach out to some representatives from ASWB because of their national meeting happening so closely to this meeting. They weren't able to attend to add any comments for discussion and also time limitations, but they said that they were available to attend a meeting in December. So,
oh, okay, good.
So I think we will be able to have them maybe come and then get some updated information and also talk about some of the changes to the test they've been making as well.
Okay, good. Yeah, that would be good to hear an update of what they've been doing. I know that they were providing some free materials, test preparation materials to a lot of the schools. So, but I think they've done they've provided some additional trainings and some other attempts to address that disparity. So it would be good to hear that from them in December. We also want to be thinking about that. We've talked a couple of times about the possibility of reviving the associate social work license again as a way of expanding our workforce. But so far, none of us has come up with an idea about what an associate social worker what would be an appropriate scope of practice for an associate social worker. What issues in the workforce now, where there are a shortage of workers, could reasonably be done by someone with that level of licensure. So that's something, again, for us to be thinking about. We don't have time to take it up now, but I want us to have that on our list of things to discuss. And also the new student temporary license. We talked about that briefly. The addictions people have proposed that. And actually that was passed into law, I think, wasn't it? The addictions student temporary license, where if they've finished 60 hours of their program, they can get a student temporary license so that they can practice under supervision while they finish their education. It's a way to kind of get them early on the track into the profession. And so there could be a possibility of something similar in social work. But again, I would bet that if we were going to do something like that, it would be similar to what an associate social worker would be able to do, what their scope of practice would be with that temporary license. So we kind of have to figure out if there's really a space for that, if they can really do some of the important work at that level of education and licensure. And then possible language in the regulation on coursework requirements for applicants from non-accredited programs. Right now, we have, specific coursework that's lined out, and if people don't graduate from a CSWE accredited program, then they have to prove that they've had essentially equivalent coursework, and that's been a barrier to licensure for some people. So we want to take that up again as a way of looking at and enabling people to come in from different schools and possibly have a clearer path to licensure. Any other issues that we want to put on our list for ongoing discussion? Okay, I think we're about at the end of our time, 5 minutes early. So everybody, thanks for attending, and we will see you on December 5th. And David and Andrea, I'll see you on Sunday night.
Yeah. Would you like to do a motion or call for a motion for adjournment?
That would be great. Anybody ready to adjourn?
I move we adjourn.
Thank you, Mary. And a second? Thanks, Eric. All in favor?
Aye.
Aye.
Motion carries. We are adjourned. Have a good rest of your week.
Thank
Thank you,
you.
everyone.
Yeah.
Bye-bye.
Take care.
Bye-bye.